Ever.
Thank you. Next, we'll go to the gentleman from Florida. Mr. Steube, you're now recognized.
Thank you, Mr. Chairman. The Social Security Disability Program is broken. It's broken in its finances, it's broken in its process, it's broken in its modernization. The solution to these problems is not a dollar amount. As we have seen far too often, the federal government throwing money at a problem does not fix the process. Congress has already given hundreds of millions of dollars to the Social Security Administration to modernize its claims process. And if we have heard here today, SSA has failed completely. The Dictionary of Occupational Titles, the SSA's list of jobs, was created more than 40 years ago and last updated in 1977. I wasn't even born the last time it was updated. Some applicants have been denied disability because Social Security told them they could perform such jobs as egg processor, dowel pin inspector, or nut sorter. Yes, I said nut sorter. I mean, that's probably a good title for leadership in Congress these days, given what's going on. But though I know some folks in the Social Security Administration is denying claims based off of obscure and antiquated jobs that may not even be available. I have a gentleman who I know through my men's group, who I've gotten to be very close with, who has type 1 diabetes, has losing sight. He's now medically blind. He's had one surgery in one eye, can't see in the other eye. He's an Amazon driver part-time. He obviously can't drive a vehicle because he's now blind. I encouraged him to go to Social Security disability because that is why it was created, to help people in his circumstance, people that were working, now not working for a medical disability. And just to get the appointment was like 60 days out, just to get to the appointment to be able to then start the process, which then, we're talking about how long that takes. We're here today because of the historically high backlog of cases. Today, over 1 million Americans are waiting an average of 220 days for the administration to decide their initial claim, a more than 83% increase since 2019. The administration publishes its average hold time for its 1 to 800 number. Its own data shows that last year, the average time someone waited on hold was 32 minutes. So far this year, it's up to 36 minutes. It's unacceptable. The American people simply deserve better customer service from the government that they fund. Receiving Social Security benefits should not be an overnight process. There should be a clear vetting and examination process of claims, and not every claim will be or should be approved. But a timely process to examine cases is absolutely necessary. And these decisions need to reach transparent conclusions for the American people to take the next necessary steps. In one case earlier this year, Northern California District Judge Susan Ilston wrote that a disability claim denied by Social Security that ignored key physician records was, quote, so vague as to be essentially unreviewable. The decision was reversed by the judge and ordered SSA to pay benefits to the claimant, a woman suffering with schizophrenia, depressive disorder, and delusions. Mr. Camp, according to your testimony, half of the processing time at the initial stages of the application is consumed by the optional second step reconsideration. You note that the Social Security Administration's minimum acceptable number of days processing is 60. However, and you just stated it to the question of the chairman, current data shows that in my state of Florida, reconsideration adds 323 days to the 300 days at the initial stage. It takes 623 days for someone in Florida to get a disability. Can you explain why my state of Florida specifically has such long wait times?
There are several factors that cause the states to vary. One is that they're administered by separate state DDS programs with different staff, different management, different functionality. Another interesting factor is the extent to which the successful programs have been implemented in that state. One is health information technology, modern acquisition of the records, immediate, affordable, doesn't need to be staffed. That is a success in Iowa, say, where the processing times are very, very low because there are 2 large hospital chains in Iowa, and that provides hit access for the records, shaves off many, many days. In Florida, not so much. So there is less use of technology in Florida, and that slows it down.
Well, I have, my district alone is the most elderly district in the country. So obviously that's also part of the challenges too. If the Social Security Administration eliminates the reconsideration phase, how do they ensure fraud is not occurring, and furthermore, exactly where would available resources be reallocated?
If you focus on what is actually done at reconsideration, you would see that it's not going to catch anything. If you don't do any work at a step, there is no need for more than 1 day for that. If you are merely clicking a box that says agree, you haven't read the file, you haven't caught anything, you haven't caught false statements, you haven't caught reliable medical opinions. It isn't of any value to do the same thing again hundreds of days later, 9 times out of 10. It's just not helpful. The quality can go up at initial if you take the existing resources, the existing staff, and give them more capacity to take a look, a more careful look at initial. All of Social Security's studies, now they need to report more on what happens with these pilots and all these studies that they've been doing about the claims process, but all of it reveals that if you have a DDS only doing initial, they do higher quality work. They pay more attention. They have more time.
I just want to, my time's expired, but I want to thank all the witnesses for being here today.
Thank the gentleman from Florida.